This is Marc Steiner, host of the Marc Steiner Show here on the Real News Network. The Marc Steiner Show airs as a podcast every Tuesday, so be sure to subscribe on your favorite podcast player and don't miss any of the important conversations we have on a weekly basis. Keep on listening. Welcome to the Marc Steiner Show here on the Real News Network. I'm Marc Steiner, and it's great to have you all with us again. We all know COVID has altered our lives, and in our nation, it's killed over 500,000 people. But we have the vaccine now. All adults in the United States are eligible to get vaccinated, which is wonderful. But if you live in Brazil, and especially if you're Black in Brazil, or if you live in India, which is now the epicenter of a new horrifying COVID surge, killing hundreds of thousands of people, the vaccines are nowhere to be found. Ventilators and oxygen tanks are in short supply. Big pharma companies in the West who develop these vaccines with our public funds are not supplying vaccines to India, many of the countries in Africa, and countries like Brazil and throughout Latin America. And they won't let go of their intellectual property rights to save the world from this COVID pandemic, from this scourge. So today, we'll take a first-hand look at what's happening in Brazil and in India, and at the disaster that capitalist greed has wrought with its thirst for profits over people. We talk with Ansab Amir, a journalist and activist based in Aligarh in the state of Uttar Pradesh in India. His work has been featured in outlets like The Polis Project, Quint, and The Wire. We also talk with Mike Fox, a multimedia journalist, radio reporter, documentary filmmaker, real news contributor, who is based in Florianópolis, Brazil. And for the last 15 years, Mike has had one foot in the United States, the other in Latin America, covering political developments in that region, has lived in more than a dozen countries and written hundreds of articles and done countless hours of video. And gentlemen, welcome. Good to have you both with us.
Thank you so much, Mark.
So it's great to have you both here, and I appreciate you taking the time and staying awake for us in India. So it means a lot.
Mark. We're not sleeping anyway.
So I'm sure not. So let's start though. Let's start in India. And I wanted you to give the viewers and listeners here at Real News a sense of what is actually happening in your countries. I mean, you read the stories that are taking place in India, but you don't get a feel. You don't get a sense of the horrific nature of what you're facing. So just take us here for a minute.
Sure.
I'm sorry.
Thank you for the question, Mark. And that is what I believe the most important question here, because to be honest, we read news every day, we report news every day, and it contains statistics, it contains figures, and it contains quotes, but they don't do justice to what is happening around us. What is well and truly a nightmare that none of us could ever envisage is now in front of our eyes, and it is not going away. It is there every day, day after day, and people are having to live through it. So when the COVID crisis began in India last year itself, the Indian government was called out for its lack of response, right? Its lack of seriousness to acknowledge that this crisis was real, that it could endanger lives. Despite facing one of the most devastating effects in the first wave of the coronavirus, the government did nothing to prevent it. So I will get to it. I will get to the statistics as well. For example, today itself, the number of new active cases in India is more than 300,000, and they are more than every other country in the world combined. So that is the seriousness of the issue in India. But that does not envisage everything. When I, as an activist, as a worker on the ground in India, received 10 calls to find a ventilator for people whose mother or their fathers or their daughters, their 6-month-old daughters, might I add, are dying due to lack of oxygen, and I have only one hospital with one bed available on my caller list, it is heartbreaking to tell 9 people that their loved ones will die. I have had to tell people that, no, I'm sorry, I can't do it. And people have told me that they will die and there is nothing I can do about it. The devastating impact of the coronavirus can best be judged on the amount of people on the number of people that have come over on social media trying to help, right? The entire health infrastructure of the country now seems to be run by young people like me, students of 18 to 25 years age, who are coming together on social media, putting their lives and their nights and days together in order to find help for people, because the government, because the administration, because the people who were elected and chosen to do this task are refusing to do it. The Prime Minister of India, Mr. Narendra Modi, on April 17, 2021, tweeted that he is very elated to find a large amount of crowd of election activists, of potential voters in the state of West Bengal, where the state assembly elections were going on. This was after three consecutive days, more than 2 lakh cases. Uh, that's I forgot the conversion, but 2 lakh cases for the third consecutive day were reported in India. That's a lot of people who were on the deathbed. That's a lot of people who required immediate intervention. And the first thing on the mind of the most important person in India, the most powerful man in India, so as to say, was how many people were coming to visit him for his election rallies and how many votes he could gather in a state of West Bengal. So that is the kind of apathy, that is the kind of maladministration that has been going on in India. And it is not just that. When the first wave, when the second wave first hit India, the youth of the country realized that our nation needed support. Our nation needed a network of people to help find resources, to help connect people with one another. When this was being done, I personally, along with many other people, were approached by state authorities, were approached by police, by district administrations, that you are indulging in black marketing or you are espousing that, and therefore you could be booked. The chief minister of Uttar Pradesh had given out this notice that people who provide oxygen cylinders privately, all right, and it is important to know which context this was being said in. This was being said in the context of a time when hospitals were raising alarms that their oxygen was running out, that the patients in their ICU and their ventilator wards will die if they do not receive oxygen. At that crucial juncture, the chief minister of Uttar Pradesh gave this interview at a leading national daily that people who are found supplying oxygen privately should be tried under the National Security Act that categorizes people as terrorists, and they should be put behind bars. And a lot of people have been threatened and intimidated by that order as well. A lot of people did not get oxygen because of this reason as well. So much so that the judiciary of India, the Allahabad High Court of the state of Uttar Pradesh, had to call this out publicly. The state of judiciary in India is not very good, but the Allahabad High Court had to say this publicly, that people who died due to a lack of oxygen in the nation should be categorized as victims of a genocide. So a state-backed judiciary calling out its government for a genocide, and then the government choosing to be apathetic and lack of and having such lack of empathy is nothing short of criminal, in my opinion. And to continue with this, like you very rightly brought up the fact of vaccination. Indian central government has been acquiring vaccines at a very reduced price as compared to the respective states. So India got vaccines at about 150 rupees per dose. Now, these are two basic vaccines in India: the Covishield, which was being produced by the Serum Institute of India, and the Covaxin, which was being produced by Bharat Biotech. These are being sold in the markets of the EU, the US, and the UK for prices as low as 160 to rupees 300. So as between this range. For Indian states, for the states in India, these vaccines would be sold at a price of 600 to 1200 rupees. And then too, these vaccines are not available for general citizens. People have been waiting for their registration slots to be booked on the CoWIN platform. The O2Ps don't reach. Even if they do get a registration, that is cancelled a day or two after that. And therefore, this curve that India is witnessing in terms of the coronavirus crisis, it does not seem to be flattening anytime soon, because the egos of our administration does not seem to be falling anytime soon as well.
But the picture you painted, this is one of the bleakest I've heard, and I want to come back to some of the things you just said about the kind of criminalization of people who are trying to solve the problem and the dangers that lie ahead. But we'll come back to that and kind of. But let me jump to Brazil for a moment. I mean,
Sure.
And I know, Mike, you wrote this piece for PRI. And you focused on the Brazilian Black community and what's happening there, which is a significant community in Brazil. And so, give us a sense of what's happening on the ground there and the disaster in front of you.
Well, disaster is a good word for it. I mean, it's important to remember that roughly 75% of Brazil's poor are black and brown, black and multiracial. Many of them live in favelas in the poorest communities. Many people do not have, these are by and large people who are working in the informal sector, and unemployment has been spiking, hunger has been rising, poverty has been rising. We've been seeing these soup kitchen lines kind of stretching around the block. And the impact has been devastating. According to research from a think tank, an Afro think tank, it's called Afro, it's from the state of Sao Paulo in Brazil. Roughly, there were 30% more deaths in the black community last year from coronavirus, from COVID-19, than by white Brazilians. And also, up until, say, as of March, white Brazilians had received 2 times the number of vaccines as black Brazilians. So it's intrinsic within the Brazilian system of social inequality and social racism that all of this has been happening. Now, I've been talking with a lot of people, doctors in poorest communities. In fact, one of those communities is this one doctor who I was speaking with a couple weeks ago, and this is the exact same community where police just this last week raided that community. It was the deadliest raid on a Rio de Janeiro favela in the history of the city of Rio de Janeiro. And it's another sign of how the state and how state police forces. So in the middle of a pandemic, when particularly black communities already have their back against the wall, already have to be traveling on public transportation in order to get to hospitals, we already understand the inequality within the system because black Brazilians and poor Brazilians, by and large, have to use the public universal healthcare system. And let me just say that the universal healthcare system has saved, by and large, thousands, if not millions of lives throughout this pandemic. It's been extremely important and has a history of being extremely important. I mean, Brazil, just to put this in context, has an extremely robust universal healthcare system. And in fact, it's kind of seen as the model for most of Latin America. And that's why this pandemic has been so devastating. But at the same time, because of funds and gutting of that healthcare system in over the last 5 or 6 years, what it's meant is it doesn't have the same resources as the private sector. And so black Brazilians, poor Brazilians, by and large, they're using the public healthcare system, which is also not equally distributed around the country. There are more robust healthcare systems and more robust clinics and centers with greater technology in the south of the country, which is where by and large you have a larger white population. And then once you get into the city, black Brazilians, poor Brazilians have to travel further on public transportation in order to get to those ICU beds and things like that. So it's an unequal system that has obviously made a huge dent on the black community and poor community in Brazil, and it's been disastrous. And again, this question of genocide is a question that's coming up here more and more. Speaking with doctors, speaking with researchers, they're saying this is what we're seeing here right now. Brazil now has roughly 420,000 dead, and many blame the Bolsonaro government for just a complete failed response to the pandemic.
So there's a couple of things here that I hear both of you talking about, and you both have used the word genocide to describe what is happening in your countries. And we also both are living in countries whose leaders are from a very right-wing nationalist organizations, both Bolsonaro and Modi. And if you tie that up in some senses with this whole big pharma and world capital, and how they and taking the intellectual property rights for vaccines and holding them close. I just read an article in New Republic this morning about Bill Gates and how Bill Gates, with all of his great philanthropy, is actually fighting to save these intellectual property rights, and is part of the problem, not the solution, about what we're facing in the world. And so as we say, certain matters of existence tumble downhill, and it seems like they're tumbling into Brazil and tumbling into India and tumbling into South Africa that do not have access to these vaccines. I mean, so it's like you all are caught in the midst of both a right-wing government, these variants out of this COVID pandemic that could be even more dangerous than the ones we face here in this country, in the United States. And the capitalist system is worried about their profits, so you won't even be able to get what you need into the year 2024. So what's the response to that? I mean, it just, I'm hearing the horrific stories you're telling. So what is the response? Where do we go first? Why don't we start back to India and then we'll go to Brazil?
Yeah, I believe, Mark, that the response to that should be an outrage, should be a well and truly devastating outrage, equal to the amount of devastating violence that has been unleashed on us. I would like to use the word violence because we often shy away from using this term when the perpetrator of violence is the state. And it is important to notice that when people are dying due to a lack of work on the behalf of the state, or when a lack of empathy by people who are as well positioned and as influential as somebody as Bill Gates, as you very rightly pointed out, we shy away from using the word violence. I would like to say that this is an act of violence on the people who are dying due to a lack of vaccine, and therefore the amount of outrage should be equivalent to the amount of devastating violence that has been unleashed upon these people. For example, I have these statistics of how many vaccines the UK and the US and the Gavi have produced, have procured for their citizens, and the accumulative sum and gist of it is that they have enough to vaccinate their citizens 3 times over. India has not even vaccinated more than 40 million people completely, while its population is immeasurably larger. So, in order to understand that what exactly is the solution to this, we also need to understand what is the cause. The cause is that the international relations between these various groups, between these various capitalistic big pharma groups and the right wing organizations are symbiotic, to say the least. They fund each other, they help each other, and then they devastate together, us as citizens. And the quicker the general public realizes it, because we also have to realize that this rise of big pharma and this rise of right-wing nationalism in countries such as India and Brazil also come from a place of, a general rise in right-wing nationalism among the populace. So as and when people realize that this needs to be fought, that this was wrong, at least somebody needs to realize that this divide that has been happening is something that needs to be fought about. That is when these larger decisions should come into place. As we saw at the WTO, at the TRIPS meeting, the trade agreement over intellectual property rights, not a lot of countries were backing India and Brazil and South Africa when they asked for the waiver of intellectual property rights. US only has come back, has agreed to do it a couple of days ago, if I'm not wrong. So, in order to create pressure on the general economic bodies, in order to create pressure on world government organizations, you need to ensure that general political organizations in countries such as India and Brazil have certain freedoms and have the liberty and have the resources to actually mobilize and actually cause a narrative to take place and then turn it into action. And again, following from what Mike talked about, there is always a clear distinction between communities who face less violence by these said authorities and communities who face more. For example, in the first wave of the COVID virus in India, the Muslim community was vilified by every corner, by the media, by the government, by the general public, because of being mass spreaders. And during the second COVID wave, the state the state espoused and encouraged a Kumbh Mela, which eventually turned out to be a super spreader. And yet, the onus of proving loyalty, so as to say, has been on minorities, has been on Dalits, who happen to be the most affected because, honestly speaking, they do not have the resources that are catering to people right now. The easiest way for somebody to get oxygen is to give an SOS call on Twitter. A Dalit household or a Muslim household does not have a mobile phone with enough economic balance to call somebody. How are they going to get on Twitter? How are they going to tag a prime minister or a CM or a journalist like Mike or I? So it is important to realize that communities are being affected differentially, and that difference has escalated to the point of time where class and communal divides have gone on to this divide over the vaccine procurement process globally, is what I'd like to say.
So Mark, I don't have an answer to that. I wish I did. That would be fantastic. What I do have is several really important points that I think we need to understand, and also to put Brazil within this larger context. First thing is that the Brazilian Senate, despite the Senate and Congress in Brazil being overwhelming conservative, the Brazilian Senate actually voted overwhelmingly just a few days ago to actually break COVID-19 patents. Now, it still needs to be approved by Congress, but that's a huge step forward if they're able to do it. It's not clear if they're going to be able to do it, particularly because, like I said, it's an extremely conservative Congress and Senate and very much in the pockets of Bolsonaro. And of course, Bolsonaro is totally aligned with the United States as much as possible, formerly totally aligned with Trump, but he's had to do what he can in order to kind of embrace Biden and to buddy up to Biden. And we saw that obviously with the climate change talks, where Bolsonaro said he was going to fight deforestation and climate change, even though everything shows that that is never going to happen, and that he's not going to do that, and he continues to not do that. So that's one thing about the Senate. Number two, the United States actually lobbied, and this is fascinating. If you look at the budget, the document for the budget over last year, there is a line item where it shows that the U.S. Health Department actually lobbied Brazil not to accept the Sputnik vaccine from Russia. Now, so there's been information that's broken on this. There's been much reporting. Sputnik was actually denied. It was rejected by health regulators here in Brazil just a couple of weeks ago. And this is a major vaccine that particularly the northeastern states had been trying to negotiate. And they were expecting tens of millions of vaccines of the Sputnik vaccine to come into Brazil within the coming weeks and the coming months. And that has been rejected so far by health regulators. The health regulators, Bolsonaro has them under control, which he's helped to appoint some of those people at the very end of last year. In fact, they still haven't approved the CoronaVac vaccine for full use and local production in Brazil. They approved an emergency use of CoronaVac. CoronaVac, if you remember, that's the vaccine from China that they were doing and they were producing in conjunction with the Butantan Institute in Sao Paulo. And that was a major loggerhead between Sao Paulo State Governor João Doria, who was all for CoronaVac because he was trying to push for some vaccine in the absence of vaccinations, in the absence of purchases by the Brazilian government. And of course, Bolsonaro does not want CoronaVac because, he says it's a Chinese vaccine and because this is his adversary, João Doria. And so he's been pushing for AstraZeneca. So what we've seen is reduction of the amount of CoronaVac vaccines around the country. At the same time, Bolsonaro, we have been getting in more and more AstraZeneca vaccines. The problem is that many people who got that first CoronaVac shot now are finding it hard to get their second shot. So it's playing politics with people's lives. It's playing politics with vaccinations. In fact, that's what we saw here from the very beginning. Bolsonaro, he is now under investigation by a Senate inquiry commission that is looking into his handling of the pandemic, the number of deaths, particularly looking at what happened in Manaus, particularly at the beginning of the year when Manaus ran out of oxygen, and also looking at the times that he rejected possible purchases of vaccines. According to reports, there's been 11 different times since the very beginning of the pandemic when the Bolsonaro government was in contact with vaccination companies, with pharmaceutical companies, and he rejected those agreements. And so that's a big thing that is now under investigation. The investigation is supposed to happen for the next 90 days. Of course, this is looking out towards next year's presidential elections, 2022. So there's all of this is happening at the same time. And just over the last 24 hours, we also had this bombshell, and I'm going to tie this back into this pharmaceutical vaccination question. We have this bombshell that Bolsonaro has had this secret budget in which he's been helping to purchase, basically buying congressional support, buying congressional votes. And it's a 3 billion reals budget. So we're talking about roughly $700 million of this secret budget that he's been kind of putting aside to buy, to put money into to buy specific projects for congressional members and pork roll things. One of those things was the purchase of tractors at 259% rated up. So extremely more expensive tractors for a congressman aligned with the agribusiness sector. So instead of purchasing vaccines, instead of using that money to buy vaccines for the country, he's been having this slush fund to shore up votes in Congress. And that was just over the last day. So, in Brazil, a lot of people, they've been really focused on Bolsonaro and Bolsonaro's government and his role in actually not trying to vaccinate the population or being very, very slow in that whole vaccination process. I mean, it's a mess everywhere. But the big thing that people are talking about in Brazil is Bolsonaro's fault within that.
So, I mean, it seems, given what the both of you have been saying, that when you live here in the United States, you can become very myopic about what's happening in your own country and not caring about the rest of the world. But the scenarios you both are painting here, to me, say that this pandemic is just going to get much more dangerous and serious around the globe, which means it just grows exponentially, and many more millions of people could die in countries like Brazil and India and South Africa and other places around the globe. And also the way you're describing this, it's also, I am not a conspiracy theorist. I just stay away from that stuff. But what's happening here though is a juncture between big pharma, these right-wing governments, the battle over profits. I mean, big pharma in America is supposed to could make up to $15 billion on these vaccines. And much of it on the backs of people in your countries that you live in. So knowing that, I mean, let's take this in two quick parts here before we conclude. One is, what does it mean politically for the two countries? Are the right-wing governments under Bolsonaro and Modi in danger, in trouble because of what's happening now? Or is that nationalist fervor and that right-wing mentality so powerful, this is not going to dent it? Let me ask the political question first, then I'm going to come back to the next question before we conclude. So, what about Brazil? Is a movement building because of this?
I mean, there's definitely a movement building because of it. Obviously, people are radicalized, and again, just to roll back to this question of, we get so caught up in these question of numbers, we forget that these are people's lives. 420,000 people. My wife lost her grandmom a month ago. People are dying every minute, and people are in ICUs. The situation here in Brazil, compared with India, has improved a little bit. There's only 10 state capitals that are now have their ICU units over 90%. That's reduced a lot. One of them is here in Florianópolis, here in Santa Catarina. So it has improved somewhat. But there is obviously, there's this movement against Bolsonaro. But at the same time, he's shored up his support with his own people. You have to think of Bolsonaro like the Trump of the tropics. You really do have to think of him as Donald Trump. So he was able to maintain his roughly third of the population, and that's what Bolsonaro has been able to do. According to the latest poll from last week, I think his rejection rate is around 58%, and his support is somewhere around 35% or something like that. So obviously, those people who have been impacted by the pandemic, and there are so many, this guy has to go. And that's why everyone's looking towards 2022 politically here. Remember, it was just a few months ago that Lula had his former president, Luiz Inácio Lula da Silva, who was the front runner for the election in 2018. He left office with almost 90% approval rating back in 2010. And he just had those corruption charges against him completely absolved. So he is now the front runner for next year's presidential elections. And according to most of the polls, he's as much as 10 or 15 points ahead of Bolsonaro. And that's really where people here in Brazil are really trying to focus and putting their hope, right, that this is going to end by next year. Of course, we never know what's actually going to happen. And remember, it was the 2018 presidential elections where Lula was actually jailed and not allowed to run. And that's what opened the door for Bolsonaro to kind of come to power. But there is something, there's two small things, Mark, I wanted to say here. I was interviewing a philosophy professor in 2019, shortly after Bolsonaro's inauguration. She had left the country because she had been facing death threats. And I was talking to her. I was one of the first journalists to interview her shortly afterwards. And she said something that stuck with me. I've been listening to it again. She said, listen, if we do not stop and do not build a democratic movement against, at this point, Trump as well, against the Trump governments and the Bolsonaro governments, what we're going to see is much more death. It was fascinating because I heard this. It gave me the shivers just a couple of days ago, because that's exactly what we've seen. Now, she couldn't have known that we were going to have a pandemic and all the rest of it. But what we've seen is a policy of death where his government, and there's been a whole research on that in Brazil, where his government actually pushed policies to help the virus spread and grow. So politically in the country, he's been shoring up. When he talks to his supporters the same way that Trump does, right? When he pushes disinformation and misinformation and continues to rail against lockdowns, whatever else, he's talking to his bubble. Now, some of his advisors are now saying, listen, you can't just talk to your bubble. You actually have to put on your mask. You have to talk to the entire country. But he believes that he can probably win it. And he's not going to change that tune. That's how he came into office. And that's how he's going to push it through, or he believes. So these are the big questions that I think that many people in Brazil are grappling with. Has it changed the entire map? No, but it's made the divisions that much more, those divides that much deeper, and it's made the situation that much more dire.
So we don't have very much time left here, but Ansab, I mean, so is Modi and the right-wing Hindu political coalition, are they in trouble or not? Does this affect them?
I'll get to this question. This is a very good question, Mark, because I have been pondering about this for the last 10, 20 days, whatever. I would like to believe so, but there is very little evidence to show for it. I personally have anecdotal evidence about it. There was this one guy. He's a soft right-wing supporter. In India, we call them a soft Sanghi, right? So I was trying to help him out for his family to arrange an ICU bed. That the beds were in huge crunch. There was not a lot of resource available, but I was trying my best, and he was a friend. He still is, I believe so. And he had a difference of opinion about me because of my politics. So he texted me that, Ansab, the bed has been found. The patient is good. And I regret ever asking you for help because of the difference in our politics. So this is coming from a person who knew that their mother or their father or their relative or their friend, whoever it is, they needed something to live. And I hope that they also realize that their government, I say this as their government, while it is also imposed on my head, but the government that they chose was unable to provide it to them. And yet they had a difference of political opinion with me. And yet they had this conversation with me. And it is not just an isolated incident. It is happening across the country. It is happening across the nation. There was this very eye-opening incident at the very beginning. I think it was on the 18th or 19th of April, that a Hindu patient refused to be treated by a Muslim doctor. He said that he'd rather die. And this is documented. So in such cases, I want to hope, but I cannot hope that India would rise against this right-wing nationalism. I want to hope, but I can't, because so far what we have been doing in essence is not helping the government fight the virus. We are fighting against the government to stop the virus, essentially. So in such difficult situations, it is very difficult for me to hope that that Modi or that this right-wing BJP government is in danger. But I would like to believe so, that there are some promising results. For example, in the West Bengal elections, for which Modi put all the Indian tribes at risk, for which he asked the crowds to come in, for which he gloated over the number of people in front of him, he lost that election. Right. So that gives us a glimmer of hope. Also, this is a very devastating truth. I bury 4 or 5 people almost every day. I receive 100 calls every day, and in those calls and in those text messages of desperation and anger, I find a desperation and anger against the right-wing government. It is an inhumane thing to imagine, but the amount of human loss and tragedy may trigger a response against this government. And it might sound very insensitive for me to say this, but if that tragedy can make some people see sense, then I hope nobody has that tragedy. But I do hope that if, God forbid, they do undergo something like that, it opens their eyes, is what I would like to believe in. Also, more importantly, the fact that the politics in India, or the right-wing politics, it is very centralized, so as to say. So the BJP government, much like how Mike said that Modi or Bolsonaro is very similar to the Trump of USA, I would like to believe that Modi is not similar to Trump. He's worse. Why so? Because when somebody in USA is calling Trump out for lying, right, which the CNN sometimes does, the Real News Network has been doing, those people do not have to worry about being in jail the next day. Those people do not have to worry about their laptops or their recordings being confiscated. They do not have to worry about being intimidated by multiple levels of state authority. And in that situation, the Indian government has been far worse than Trump. Also, to put into context, this community that I belong to, the Muslim community, has been accepted to be the de facto defaulters of everything wrong with India, right? Something goes wrong, we are the cause. Something goes wrong, then we are the people who cause it. Something goes wrong, then we are the anti-national. Something goes wrong, then we are the reason why this country is not doing well. And despite everything that we try to do, it is never enough. Only a couple of days ago, there was this case that a war room against coronavirus in Bangalore had 205 employees. A right-wing BJP leader called Tejasvi Surya handpicked 17 people and said that these were running a madrasa. These people were trying to run a scam to ensure that no beds were given to patients in need. And those 17 people were then intimidated by the police and then were fired, right? Out of 200 people who were trying to help. And the authority and the organization that they worked for in in private conversation to journalists told that this was not the case. In fact, it might, like, they insinuated that the scam was being done by the other end of the party. So in such situations, it is difficult for me to hope, but I try nonetheless.
Well, the pictures you paint are of what's happening in Brazil and India are frightening and eye-opening, and it's the reality of what really capitalism has done to the planet. And so you can't, since you cannot we'll do this very quickly because we do have to end, but you take Bolsonaro and Modi and their respective governments and Big Pharma in America and the power that they have in the U.S. Congress and the crisis both of your countries are facing when it comes to COVID. Part of the solution lies here in the United States, lies with us, because we hold the keys to the vaccine, to the medicine, to fighting COVID, to making this whole again. So what's that final message for the folks here in the United States and in Europe that are listening to this broadcast, watching this broadcast, about what should happen next? What do you think they should be thinking about? Very quickly. Go ahead, Mike. You can start. It looks like you're ready. Go ahead.
Yeah, Mark, I'm just going to say something that, I've been talking a lot with other friends of mine about, and this is just the simple fact that if you look at the map of where the vaccinations have taken place and who has the keys to the vaccines, like what you've said, they're all in the north, or they're in Europe. They're in the powerful countries. Even here in South America, they're in Brazil, where the country, although it's been slow, it's because Bolsonaro hasn't actually acquired those vaccines. Not that the country can't get them. It's just that Bolsonaro hasn't gotten them. But if you look at Africa, for instance, so many other countries and many other countries in South America and Central America, their ability to actually acquire the vaccines is terrifying, because there just is none. And if you think about where this is going to be, Brazil, the big problem that we've had is the fact that when you had a huge amount of cases in one area, then that's what creates these new variants, right? That's why we have the Amazon variant, this P1 variant, which is the main variant that's covered all of Brazil, which has led to the second wave in Brazil. Not just Brazil, but all of Brazil's neighbors have been collapsing under COVID-19 from the Amazon variant that came from the Amazon. We need to think about the battle. And look, we should have been thinking about this as a long time ago. The battle against COVID-19 and coronavirus is not just one country, and once I'm vaccinated, it's fine. Borders, the viruses don't care about borders. It's going to travel anywhere. And even if we can vaccinate our own countries, well, that's fine. But you know what? Other countries are going to be dealing with this for years and years and years if we don't find a way to actually support each other and get the vaccines to where they need to go. This is not an issue. People are making, like you said, making billions of dollars. This should be a situation where those vaccines are going out into the world, and we're caring about those people regardless of what country they're in or what side of the border they were born on. It's just ridiculous.
Ansab?
Yeah, at the very outset, I'd like to say that, as Mike also rightly pointed out, the global north has a lot to do. And it has been documentedly shown that the global north can do things if they get to it. When the USA was not supplying the raw materials to India for making vaccines, the outrage in the USA led to the Biden administration making a change, which was a positive change caused by outrage. And that is not something which must be restricted to this point of time. In India, as we've seen, 162 oxygen plants were sanctioned to be made out of the PMKS fund, out of which no accountability is ever have been has never been given. But outrage about it can work if global ambassadors, if prime ministers of other countries, of heads of states of other countries do make this government accountable and do help out as countries have been helping out. It can bring a change. It can force the government to reconsider its lines. Because honestly speaking, there are very few things in the world that Modi seems to care about, but his image is one of them, right? So if enough pressure is being applied on him, he did accept, after a huge amount of outrage, he did accept the Moderna and the Pfizer and the Johnson and Johnson vaccines to be given expedited approval for usage in India, right? So that amount of outrage, that amount of concerted effort always works. I remember there was this case of the New Zealand ambassador in India asking for an opposition youth member to help out one of their members in their embassies, right? And the Modi administration immediately created an entire misinformation campaign to rebut that news. But when Jacinda Ardern clarified it, when she said that yes, there was a need of an oxygen cylinder, and yes, somebody else arranged for it, she also said that they should have gone through the right proper channels. But it is important to note that that amount of international attention brought the Modi government into some sort of stimulant that they had to work, that they had to get their own volunteers, then their own administrative workers to do something. Helplines were created after that incident, which worked for a day or two, but they were created nonetheless, which was not happening before that incident. So I believe that the global north, with its federal structure and with a proper political campaign for urging their heads of states to help the global south in this time of crisis, is something that can work, that has worked in the past, and I believe would work in the future as well.
Well, this has been a fascinating discussion. I think we've all heard, watched, and learned a lot here. And I want to thank you both, Ansab Amir and Mike Fox, for joining us today, and also wishing you both to stay healthy and safe through all that you're going through, and your friends and neighbors are going through. So thank you so much for joining us here today on The Real News on the Marc Steiner Show. It's been a pleasure to talk with you both.
Thank you, Mark. It has been wonderful.
Thanks so much, Mark.
Ansab Amir and Mike Fox, once again, thank you both for being with us. And I want to thank all of you for joining us today. Please let me know what you think about what you've heard today and what you'd like us to cover. Just write to me at mss@therealnews.com, and I'll get right back to you. If you've joined us there, please go to realnews.com/support, become a monthly donor, and become part of the future with us. So for Stephen Frank and the crew here at The Real News, I'm Marc Steiner. Stay involved, keep listening, and take care.